Welcome back to TV5 News at 9. We are talking about the COVID-19 vaccine this morning and how to best prepare. Joining us from Great Lakes Bay Health Centers is Angela Williams. Thank you so much for being here today.
Good morning, Colette. Happy New Year.
Good morning. Happy New Year to you as well. Thank you. So, Angela, this vaccine, the news is so exciting right now. Tell us why it's so important for everyone who's able to receive this vaccine.
Well, it's important because, first of all, we see how many people's lives are being lost from the COVID-19 virus. The vaccine will help keep us from getting COVID-19. At the same time, based upon the clinical trials and all the studies, it will also reduce our chance of getting serious illnesses related to respiratory conditions and life-threatening complications of COVID-19. The vaccine is an important tool to help stop the pandemic of COVID-19 virus.
That is so true, Angela. And you know what? There are so many misconceptions out there, and let us dispel this one. Can the vaccine actually give someone COVID-19?
Let me just make it clear, the COVID-19 vaccine, whether Moderna or Pfizer, neither one of those vaccines can give you COVID-19 virus.
Okay, that's good. That's what we need to hear. Now, who should get the vaccine, Angela, and who should not? Who should avoid it?
Anyone age 18 or older can receive Moderna vaccine. Anyone 16 and older can receive the Pfizer vaccine. At the same time, if you have any concerns about history of anaphylaxis or allergic reactions to injections, consult your physician prior to get it if you have any concerns. But at this time, unless you have severe reactions, you are still safe to receive the vaccine. When you receive the vaccine, you are required to be monitored for a minimum of 15 minutes in the event that you have any type of emergency or allergic reaction to any of the COVID vaccines.
And Angela, why are you hearing that some people are so nervous and they're skeptical about this vaccine?
Well, in addition to historical health policies and clinical experiments, especially in the Black and Brown community, there's a lot of mistrust around the COVID vaccine because even the social media has generated messaging that has been negative. And so it's important that in every community, we work with community leaders, faith-based communities to amplify the voices of people of color in order to dispel the myths, ease the fears, build the trust, and disseminate proper information about the vaccines.
And so we're saying that all health officials and doctors are saying this vaccine is effective. And Angela, tell us also, is this vaccine readily available right now?
Currently, we are following the guidelines from Michigan Department of Health and Human Services and Saginaw County Health Department, and so the vaccine is compliant through Great Lakes Bay by following the phases. So currently at Great Lakes, we are on phase 1, which means that our goal and priority is to immunize our healthcare workers. However, we do encourage adults age 65 and older to go to the health department's website and register for reserving my dose of COVID vaccine. If you're not able to utilize technology, you can call 989-797-6880 for someone to take your reservation for a dose of the vaccine. Also at Great Lakes Bay, we eventually will be providing the vaccine for our patients and probably at some future date the general public, but we are compliant with the phases as governed by the state of Michigan. I am an African American and I'm of an age of high risk for for COVID virus. I've had several chronic health issues which I've been concerned about, and I know that it's important that I get immunized with the COVID vaccine, which I did last week. And I can truly say that I had minimal side effects, a sore arm, which is a common side effect of the COVID vaccine, And please, my message to the community today is to become an informed healthcare consumer. Know your knowledge on your own. Don't just listen to the negative information that you hear about the vaccine. We want to save lives, and the only way that we can save lives is to be informed with accurate information.
I love it. And lastly, is there a cost for the vaccine?
There is no cost, no out-of-pocket cost for the vaccine. However, we will ask for your insurance information, and those of you who are uninsured, we have programs to cover the administrative costs only. So I'm going to be clear with that there is no out-of-pocket cost, but we would like your healthcare insurance card if possible.
We love it. Thank you so much for joining us today, Angela. We appreciate it.
Thank you.
I'll be getting the vaccine when it is my turn. You have a great day as well. Thank you. And if you'd like any more information, make sure you check out the hot link section on WNEM.com.